Q&A on the coronavirus outbreak. We're going to be answering your health and travel questions with the Health of ITV News consumer editor Chris Choi and GP Dr. Sarah Jarvis. And I also should say that you're clinical director, aren't you, Sarah, of patientaccess.com, so you know all about this. You can ask your question by emailing your story at itn.co.uk, or if you're watching on Facebook, by posting in the comments section. Now, I would say that we had lots to ask you, Chris, but since the Prime Minister's press conference this afternoon, less about travel because no one's going anywhere for the moment. So, Sarah, we're going to be putting the majority of the work on you, but thank you very much indeed for being here. OK, so let's get to some of the questions then. First of all, this is about pregnancy, because it's the first time we've heard pregnant women being mentioned, isn't it? Brooke says, I'm 12 weeks pregnant. I've read that Boris Johnson has said pregnant women must avoid social contact, only go out when necessary for the next 12 weeks. I work in a school, Brooke says. What does this mean for me working?
Well, I have to say this is a challenging one because until today, the recommendation that we were giving out is there is no evidence that pregnant women are at higher risk of having serious complications, and there is as yet no evidence that mothers can pass this on to their babies in the womb or pass it on through breast milk. However, I think what we're doing is we are in unprecedented times. I don't know if anyone's noticed. And effectively, I think what they are saying is because we know that with other viruses such as flu, there have been far more impacts on pregnant women. I think they are really very much playing it safe here. And although I really wouldn't worry too much about your individual risk, I do think that it sort of makes sense to say, look, you probably can in this at the moment. It's not going to be that difficult. You're not going to be that different from everybody else if you stay at home. So if you are pregnant, then try and reduce your social contact. Don't go into work.
OK, don't go into work. So that's your advice for Brooke, who's 12 weeks pregnant.
I would. It is. And I would say that, you know, for instance, it's not going to be exactly the same. What we're doing when we're talking about people self-isolating now, and another part of the guidance today, of course, which has changed, is it's not just the person who's got a fever or a cough who should self-isolate, but their entire household. And not for 7 days, but now for 14, on the basis that once you've got symptoms, you're usually most infectious for the first 7 days. And by the end of that time, if you're still feeling unwell, you continue to self-isolate. But also, for the rest of the family, the average time to develop symptoms is about 5 days. 97.5% of people will develop them by 11 days. So the rest of the family has to self-isolate until we're past that extra weeks period.
And once you have actually had the illness, how long after that should you still be isolating, after the symptoms have subsided?
Well, the problem we've got is that a lot of people at the moment are going to be self-isolating without actually having COVID-19. And I think we must make that clear. But the rationale for self-isolating for at least 7 days previously was that if you had it, the chances were that by 7 days you would either be better if it was a cold, or you would be still unwell if it was COVID-19, or you would be getting worse if you had one of the more severe complications. Now what we're saying is 14 days. And we know that the time you are most likely to pass it on is in the first 7 days. But if you have serious illness, you can continue to pass it on for some considerable time after that.
After your symptoms have stopped exhibiting? Or
some people who still have got rid of the fever and who previously were allowed to go out would still be coughing. The rationale was you are less infectious then after that first 7 days. But most people will still be infectious if they're coughing a little bit, just not quite as much as they were in the first 7 days.
OK, all right. So now let's move on to the over 70s, all right? Somebody says, one of the questions here, with the over 70s being told to self-isolate, what happens if they have relatives living with them that are younger and still coming and going? And this is a very big problem, isn't it?
Yeah, I'm afraid it is a huge, huge issue. Now, again, we're in this situation where we're talking about something slightly different from self-isolation to protect yourself, which is what we're saying to the older people and people who are vulnerable because of long-term conditions. And basically, if you are invited every year for the flu jab, and you're under 65, unless apart from children, then that is because you're in a high-risk group. So you all need to consider yourselves in a high-risk group, and this applies to all of you. What we're saying is that currently, when people isolate because they might be infectious, we're doing it to protect everybody. So you have to be incredibly strict there. So you should be staying in a separate room from everybody else, ideally using a separate bathroom. You should not be sharing cups, plates, crockery, cutlery, bedding, linen, towels, anything. You should ideally not be in the same room as them, and you shouldn't even go out into your garden unless you've got at least 6 feet either side of you. That is very different from what we're saying here with isolate yourself to protect yourself. However, what I would say is that if you've got people coming and going into your house, they need to, ideally, you ought to keep yourself away from them as much as you possibly can. And ideally, if they do come anywhere near you, they must be scrupulous, absolutely scrupulous about washing their hands. And if they have the slightest hint of a smidge of an iota of a fever or a cough or even a runny nose, because that's much less likely to be coronavirus, but if you've got someone vulnerable, don't take a chance. They must stay away from you completely. However, what the government has now clarified today is that if you are in one of those at-risk groups and you're self-isolating, you can still go out for a walk, which is not the same if you're self-isolating because you might infect other people.
OK. Again, on the issue of the over 70s, Jenny says, myself and my husband have self-isolated as I am vulnerable. She doesn't say particularly why. I have a few neighbours living alone, also over 70, who will have to isolate themselves too. Please, can you tell me, we will all be in the same boat, so to speak. Does that mean we could visit each other?
No, I really wouldn't suggest that you visit each other. And the reason that I say that is because what we've seen in America, in Seattle, in the nursing home, is that they were in very close contact with each other, and that one person gets it before they develop symptoms or before they realised they had symptoms, they had passed it on to others. So I'm afraid it very much does mean that you shouldn't be visiting each other.
But this is going to be so lonely, isn't it, for people who are really vulnerable to
Yes.
loneliness anyway?
It absolutely is. And about a few days ago, I said, if you were thinking of visiting Granny on Mother's Day and taking her out for lunch, I would strongly suggest the best present you can give her is to give her an iPad or a computer or something that has FaceTime or Skype or something advice so that you can keep in touch with her. Because it is going to be lonely. It is for 3 months, and it may go on a bit longer than that. But the alternative really is unthinkable. We are going to be reaching the really steep bit of this peak in a very short space of time, within a couple of weeks. And when you have vulnerable people who have up to a 1 in 6 chance of dying, and a much greater chance than that of being in hospital and being really unwell, I genuinely think there isn't an alternative.
I don't know if you heard on the radio this morning, David Blunkett was on, and he was very defiant, and he said, I'm over 70, I'm not going to self-isolate, this is ridiculous.
Then he could kill somebody else.
OK, so that's your message to anyone who might be being defiant.
Yeah, I mean, I think
brave, in inverted commas.
I've said this morning, and it's an expression which I suspect I shall use again. You may think that 70 is the new 30, but your immune system hasn't read the memo.
OK, I think that's clear. Sarah, thank you for the moment. I've got one for you now, Chris. This is your moment. All right. If I can find it. Ah, yes. Barry says, I'm over 70. If I have to stay indoors, it would mean shopping online. How safe are the packages that are delivered? Well, actually, this is one for both, isn't it? Should I have them left on the doorstep, collect them after the delivery driver has left? Should I avoid contact with the package for a number of hours after the package has been delivered? Discuss.
It's an interesting one, isn't it? And actually, on that very point today, the delivery firm Deliveroo that takes food round to people said that they are going to start doing contact-free deliveries. You can tick that option when you're ordering food, and their delivery people will leave the food outside, so there is no contact.
But someone still handled
at some
it
stage, absolutely
prepare
right.
it, of
And
course.
there are some people that were worried about the package has been on the floor. Very early on in this crisis, we saw, for example, mail coming out of China being specially treated to as far as possible, remove any contamination. It is a very, very difficult one. We know from speaking to experts like Dr. Sarah that this virus can hang around on surfaces for hours. So to be really certain that there's not something being brought into your home, you're going to have to leave it for that kind of period of time.
So I would say you're absolutely right. The problem is we don't know about it. The reason that things were being treated when they came out of China at the time was because we didn't know how long the virus could survive, and we were trying to stop it getting into the country. It's here now. We can't stop it getting into the country. But what we do know is that the best evidence we've got is that it can survive on hard surfaces, so glass, metal, plastic and so on, for up to 3 days, and on cardboard for up to 1 day, so probably the same on paper. That will be affected by the temperature outside, the ambient temperature, and it will also be affected to an extent by how much you're handling it, because we don't know how much virus is getting on there. What I would say is you are absolutely fine to bring it into your house, put the things away. You can leave them on the side if you want. If you're not going to eat, don't touch them immediately and eat them immediately. But basically within a day, certainly within a couple of days, all the virus will be gone. But when you're going to put them away, go put them away. And if you're opening post, open the post, dispose of the post, clean that surface with detergent, and then wash your hands really thoroughly, and you will be fine.
Okay.
And worth saying, actually, because a lot of people will be turning for the first time to online deliveries. It's quite clear from talking to the retail sector that they're going to have severe capacity problems. Only something like 7% of the population normally use online deliveries from the grocery outlets. That's going to be multiplying. You will see, if you log on now, that for certain products, there are long waiting times. So if you think you're going to be in this kind of position, get online early and familiarise yourself with the situation, and make sure you're logged on and ready to go and fully registered, because there may be some waiting time. It's not as instant as you might imagine.
The site I tried today had crashed. Such was the interest online.
And I've seen waiting times for 10, 15 days on certain product lines, particularly cleaning products.
Okay. Travel, Chris. We're being informed not to travel abroad, and that came out today again. What about travelling throughout the UK? I mean, the Prime Minister did say limit travel, didn't he? But what does he mean by that?
Well, it's quite clear from what has been said.
Is it just public transport, I suppose, what I'm saying?
No, I think that if you were travelling in your own private vehicle, but then getting out into anything that is akin to a pub or a club or a theatre, and imagine what that means. Any place where you'll be milling around, where it's likely that there'll be less than 6 foot between you and others, it's a bad idea. We've heard a lot of talk about the danger of air travel. Some experts have been pointing out that travelling on a train, for example, might be more risky, because on a plane, there's air filtration. People don't tend to move around the body of the vehicle quite so much. On a train, of course, people are going up and down to the toilet, to the cafe area. There's a lot of people touching things the whole time. So trains are a particular problem, and it's a reversion back, of course, to the rules we're all getting to know so well, which is wash, 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 and try not to touch your face. But yes, this is going to restrict travel within the UK as well, and people are going to have to discuss with family and friends about saying no to certain plans and cancelling.
What about weddings? Charlotte says, I have a wedding booked for 100 guests at the start of May.
Yeah, well, it's difficult because I don't think there's much chance of this being over by the end of May.
It's not going to be.
You're shaking your head. That wedding is not going to, it's going to be a very small wedding. I know.
I think in weddings, christenings, and I'm sad to say funerals too, there'll be a lot of reorganisation. I think a lot will end up being done via Skype and similar channels of communication. People with wedding insurance may well be able to claim some money back. But even if you could conceivably go ahead with something like a wedding, would you really want to, when the very nature of these is that a mix of generations gathers together, particularly older people? I don't think you'd want that, or perhaps want to put people in the position of having to say they're not coming to a wedding. Perhaps a lot of people decide they'll cancel until a time when the whole family can get together without these concerns.
More safely. Sarah, do you want to add any comment to that?
I couldn't agree with you more. I think the situation is changing so quickly. So a week ago, we were in the containment phase, which meant that anybody who was suspected of having a case, or anyone who was confirmed, we would test them. We would then isolate them. We would isolate everybody who was in contact with them, and we would test them too. So on air, I said a week ago, look, if you've got a party booked for 10 days' time, as long as nobody's snotty and nobody's got a cough or a fever, then yes, by all means. By yesterday, I was saying, actually, I think we really ought to think very seriously about this. The one thing I do think we need to bear in mind is that we are at the start of this curve, and it is going to be a long time. So if you have elderly relatives, I think you're absolutely right about big weddings. I think a wedding this weekend, it would be foolish to get 100 people together when 40 of them are over the age of 60. But if you've got elderly relatives, particularly people who are living maybe, on their own, or you don't want to take children to them too much, by all means go and see them, but perhaps one at a time now, before we get to the stage in a week or so. And we don't know, because this has progressed quicker than even I realised it was.
Really?
And I'm pretty in the know. I think, we have regular briefings. We're kept very much in touch by the Chief Medical Officer and the Deputy Chief Medical Officer. They've been fantastic at explaining the science behind it, which is why I felt able to keep on board with the government's recommendations. But I have to say, this is happening fast.
And on that very subject, we are dealing with this differently to almost every other country, aren't we? And you're saying that you trust the scientific path that we're taking,
yeah.
and I guess we have no option because that's the path that our government is taking us on.
I can say it's based on science.
Yes.
I can absolutely say it's based on science.
But
what
different
I cannot
science
say
to other people.
well, the problem is that there are degrees of the science. So if, for instance, we put the entire country into lockdown for 3 months, we would absolutely delay the peak of this by 3 months. However, what we need to realise is that people are human. And in this country, we have a different health system. We have a different social system than we have, say, in Italy. In Italy, they have a regional health system. It's not joined up in the way that the NHS is. There are all sorts of differences between the different countries. What we've seen in this country is that the government has said, look, we're probably only going to get one chance at this. We can't isolate everybody for 9 months, or we can't isolate them for 1.25 years until we have a vaccine. We just can't do that. Therefore, what we need to try and do is we estimate people might be able to self-isolate for 3 months, but that's probably going to be it. A lot of them are going to be stir crazy at the end of that. I was hearing from people phoning into a programme just this morning saying, oh, I've lived through the Blitz, I've lived through the war, I'm not scared of this. How dare they tell me what to do?
So spicy over 70s again, isn't it?
Yeah, they're trying to save your life. I'm sorry we are.
I think that's clear. Right. Chris, hand sanitizer. This is the big question, isn't it? People are really getting very anxious about the lack of hand sanitizer. When are the supermarkets going to get it back on their shelves, and how are they going to do that?
Well, their first line of defence is to try and influence our behaviour. It's quite clear that there would have been enough hand sanitizer had there not been the stockpiling that went on and people taking more than they needed right now. And that, of course, has a ripple effect. And we see the gaps on the shelves. Once we see the gaps on the shelves, then the behaviour is amplified and other people follow suit. It's a big problem. And they're not going to be able to catch up with demand unless people resist the temptation. It is understandable. People want to protect themselves, their families. But it's also kind of selfish if it leaves others without even the basic supplies. So, as we saw at the weekend, the big retailers put out this mass appeal, please stop stockpiling.
But people aren't listening, though.
People aren't listening. It's got a sense of momentum, but they may start to listen. So that's the first line of defence, to try and stop the panic buying. Secondly, they're cranking up production as fast as they can. Slight problem is that some of the basic ingredients that go into these sanitizers are now getting in short supply internationally because, of course, we've got to remember this is happening around the world. It's going to potentially have an effect on the pricing of these products and continuing lack of availability. But remember, of course, if available, washing your hands is just as good for the old 20 seconds. Of course, I understand when you're on a train and out and about, having the sanitizer is much more convenient. But
we're not going to be out and about very much anymore.
That's true.
I suppose that's one
true.
thing.
But in many instances, hand washing will do.
Okay.
Can I make a point in addition to that? Because talking of stockpiling, one thing that I think people are getting very worried about is their medication. Now, we are going to be able to prevent stockpiling in the same way because GPs have been advised or have been told that they must not issue too much medication in advance. And I really would urge people, we have got to start being sensible and to change our behaviour where GPs are concerned. Firstly, we need to get as many people as possible to register for online services so they can order their repeat medication online. It hugely reduces the pressure on general practice. Secondly, if you do want to visit your GP, you won't be able to do it in the same way. So, for instance, EMIS, which supplies about 60% of the GP practices in the country, has just made video consultation available to every practice that it supplies. It'll take a couple of weeks to come in, but people are going to need to get used to changing their behaviour, and you are not going to be able to stockpile. Please do not scream at your receptionist if you can't get more than a month.
And Mary, worth just repeating what we discovered for ITV News tonight, which is the pharmacists are now writing an open letter rather like the one that came out from the grocers at the weekend. They're saying, please don't stockpile. The one that I was talking to today was having to limit purchases of certain infant medicines, paracetamols. His shelves were literally bare. It's the same problems we've seen unfolding in the shops. And they've said, look, please think about the community as a whole when you're deciding what to go in and get from your pharmacist.
What's interesting, I think, about this whole situation is it's the first time in our lives, this generation, that we've had to think as a community, isn't it?
Yeah.
Our parents, our grandparents got used to that during the war. And this is new to us.
And the sadness is we have I'm afraid we do have a bit of a selfish population because unfortunately that's the way we've grown up. Everything is about, instant gratification. Young people worrying about, can I have the latest model of the iPhone? They've never had to worry about, can I put food on the table?
It is certainly fair, and I agree with those concerns. But we are seeing now, and at the moment, grassroots kind of organisations in local communities, churches, where people are reaching out, they're putting vouchers in local newspapers, they're doing things on Facebook saying, if you need help, we're getting a group together now. It is starting, it's very grassroots. There is, I think, a vacuum for somebody at the centre to start controlling all of that, making it bigger, because there is no doubt at all that government officials, the authorities alone cannot get us through this. This is going to be a community effort as well.
The rebirth of community, which is in a way a wonderful thing, isn't it? I've got one more question for you, Chris. Fabrizio asks, I work as a cabin crew for one of the UK's major airlines, and I am, of course, he says, very worried about lacking of earnings, possibly losing my job, as I'm sure so many are just now. What measures the government's going to put in place to financially support those who will lose essential income during this pandemic? And tonight it's pub workers, it's restaurant workers, cinema workers, theatre, everybody.
It's getting wider and wider.
Yes, it
the
is.
airlines in particular, those members of staff are under such pressure at the moment. They're right on the front line of trying to deal and improvising as they go along with emergency repatriation flights, etc., and at the same time facing layoffs themselves. People like BA have already said, quite frankly, to their staff that there will be mass layoffs. Hopefully not permanent, certainly temporary. It'll be the same with all of the airlines, I think. What the government has done already is to say that they will take the financial burden of the statutory sick pay for the first 14 days. They have made it easier for people to apply for benefits, for universal credit, and they put money into hardship funds, which will be administered by local authorities. I mean, it sounds complex, and it is. And on top of dealing with all that they're dealing with, people like cabin crew and the others that we've talked about will have to navigate that system.
Can I ask you a question? I'm not sure if you know the answer to this, but you've said, they hope it won't be permanent when they're laying people off. Surely it's illegal for companies to impose mandatory unpaid leave. Surely they're going to have to make people redundant and then re-employ them.
Well, I think it comes down, when I was speaking to airlines today and over the weekend, a lot of those airlines are having those kind of conversations with their staff and trying to stand by them as much as possible. And a lot of it will come down to the arrangements these staff have with their own airlines. And maybe that's their first port of call, of course, to have that conversation with their line management and find out what they're going to get. We only get to government support, as was discussed there, if all else fails. That's the final safety net.
It really is quite worrying, though, isn't it? Because it's going to go on for some time. Sarah, Anne asks, if you're unlucky enough to get coronavirus, can you get it again?
Almost certainly not, certainly in the short term. We do know that in the vast majority of cases, people who get coronavirus will become immune to it, or at least we think they will, as they do with virtually every other virus. What we do not know is how long that immunity will last, because with some other infections, then immunity wanes over time and you become prone to getting it again. But with a bit of luck, the evidence very strongly points to the idea that once you've had it once, certainly in this pandemic, you are not going to get it again, or certainly not in the next year of this pandemic.
And can I get your comments on this idea of herd immunity, which our government is very much advocating, isn't it? And it seems to be controversial.
I really
Explain.
hope that the government is not advocating that 60% of the population gets it and therefore it protects the most vulnerable, because that is an awful lot of people. If we are talking about 40 million people getting this, even if everybody who is vulnerable or over 70 puts themselves into isolation, and let's say none of them get it, miraculous, it's not going to happen, but even if none of them got it, even if only the lowest risk people got it, and even if we say that in that group, maybe, possibly, conceivably, because we don't know, because we don't exactly know the mortality figures for people who get it rather than the figures for those who are diagnosed, even if only 1 in 1,000 of them died, we would still be talking about 40,000 people dying. I just don't think that is acceptable as a policy. So I'm hoping that what they are doing is saying that is the worst case scenario. What we are trying to do is to delay it as much as we possibly can and hope that we can flatten out this peak until it settles down, because what you usually see is you see a first peak, then it disappears for a while, and then you see a second peak. Not always in winter. MERS proved not to be seasonal, but a lot of viruses are seasonal because in winter people come indoors and sneeze on each other a lot more than they do in the summer. But I'm hoping that that's not what they're looking at. We've traditionally seen herd immunity for vaccinations, and there it is unbelievably important. We've seen that with MMR, after the blessed Wakefield scandal, that all those children who were not immunised because their parents were terrified, they are now getting measles and mumps and sometimes becoming seriously ill while at university because they're part of that Wakefield generation. So we know that herd immunity is really effective. What we don't know is what might happen with coronavirus if people were exposed to it a second time, having had it a first time, a year later. It's a new virus. We don't know. It's not a risk I think we should be taking.
And is it just going to be something that we have to get used to living with? Because we can't do this every year, can we?
No, we absolutely can't do this every year. But one of the things you need to bear in mind is that we don't do this every year with flu. And yet in 1918, when we had the Spanish flu, when we had the Hong Kong flu, when we had the Asian flu, we were doing that. And that was because it was a fundamentally different virus. What we're going to have to hope is that this doesn't mutate so much. And I think the evidence is mostly that coronaviruses don't tend to mutate that much, that it won't mutate so much that nobody is immune to it. The reason we're doing this now is because this is a virus which, A, is very easily passed between people, and B, nobody has had, therefore nobody is immune. That's why it spreads like wildfire. That's what herd immunity is about.
Okay, and can I ask you, because I don't think there's been a lot of information about this, if you do get it, what should you do? How can you treat yourself? How can you look after yourself and your loved ones?
You're absolutely right. There hasn't been much about it because there isn't a great deal that you can do. What you can do beforehand is try to avoid smoking. We don't know whether stopping smoking now will protect you in a month's time, but it certainly isn't going to do any harm. And we know that one of the highest risk groups for mortality and severe complications were smokers. The second thing you can do is to eat really, really healthily, lots of vegetables, lots of fruit, avoid processed and particularly ultra-processed food, high sugary, high carb foods, things like that, and exercise regularly. We do know all of those will help with other viruses, and it's highly likely they'll help with this. The other stuff, the woo stuff out there, bluff, who knows? Zinc, debatable. Echinacea, highly unlikely. Vitamin C. Vitamin D may help with your immunity. So if you are low in vitamin D, which many of us are, especially coming out of winter, well worth thinking about a supplement. One of the only supplements I recommend regularly.
Okay, and a final word on exercise. We're all stuck inside. We can't exercise. What are we to do?
If you're over 70, as of today, they have said that you can go out and exercise if you are someone who's self-isolating to protect themselves rather than to avoid passing it on. But there is lots you can do in the gym.
Okay.
Indoors,
because the gyms are closing as well. I think,
gyms are closing as well, but no, there's lots you can do indoors in front of your television. You'll have nothing else to do except put on one of those videos of, Jane Fonda.
All right, you can get abs of steel while you're self-isolating. Right, and this is a final question. If going to pubs and large gatherings is being discouraged, why are schools being left open?
Now, that is a really, really interesting one. Schools are a very different matter, and the reason they're a very different matter is severalfold. The first is that the good news is we know that children on the whole tend to get a very mild illness. They may have few symptoms or no symptoms, but certainly they are highly unlikely to die. We therefore do not know if they are super spreaders, which they are with flu, or if they're not actually spreading very much at all. That's the first thing. The second thing is if we close schools, there would be vast social disruption and an awful lot of mothers who would have to stay home, and fathers, I hasten to add, work for the NHS. they're essential workers for the NHS. Finally, when we have closed schools in the past, it flattens the peak out for a couple of weeks and then you get a sharp spike. Why? Because parents can only stay home for so long and they end up forming groups. So one mum will have 10 kids one day, the next mum will have 10 kids the next day. These kids are not in school where their hygiene is controlled, where their contact with each other is controlled. They're running around somebody's crowded sitting room and you're just getting more. And the alternative is that they get carted off to the grandparents, the very people that we're trying to get to avoid social contact.
I read online there are lots of actors who aren't currently working who are volunteering to do childcare, which I think is an excellent idea.
Wonderful.
Any final thoughts from you?
Well,
Chris?
just to echo that it's not just science but society, that some of the supermarket executives have been saying behind the scenes that if you close schools, they're going to lose the backbone of their workforce. So don't expect the shops to be open as they are now once the schools close, because the staffing just won't be there, rather like within the NHS. So there are very big ramifications of school closures.
OK, thank you, Chris. And a final thought from you, Sarah.
Final thought, please, things are changing so fast, keep on top of it. If you have any symptoms, if you have any concerns, do not ring 111. Do not ring your GP and certainly do not go to your GP. There are great tools out there. Patientaccess.com has a coronavirus checking tool. I will be personally updating it tonight to make sure that by first thing tomorrow morning, it's in line with the latest guidance. If you ring 111, you could be stopping somebody who really needs help from getting through.
OK, other websites are also available.
Other websites are available, including, of course, the NHS.
OK, wonderful. Thank you so much, Dr. Sarah Jarvis and Chris Choi. Really, really interesting. And that is it for this live Q&A. But you can get the latest information and advice on the coronavirus at itv.com/news. From all of us here, look after yourselves, stay well. I'll see you tomorrow.